Board meeting for November 18th, Wednesday, 2020 via WebEx. I'd like to open the meeting. We will call the roll and establish a quorum. Beginning with myself, like I said, I'm Michael Jackson, President of the Board, appointed by the Governor in the faculty role. Brn Moderator, will you facilitate calling the rolls so we can establish a quorum?
Thank you. Dolores Trujillo.
This is Dolores Trujillo, RN, appointed by the Governor to the BRN in the nurse bedside role.
Elizabeth Woods.
This is Elizabeth Woods. I've been appointed by the Governor in the advanced practice role. And good morning, everybody.
Good morning. Imelda Sehab-Butkowitz.
Good morning, everyone. This is Imelda Sehab-Butkowitz, appointed by the Governor as a public member. Welcome.
Good morning. Karen Skelton.
Hi, this is Karen Skelton, public member appointed by the Governor.
Good morning. Kenneth Marlborough.
Hi, good morning. This is Ken Marlborough. I am a public member, vice president, and appointed by the Senate Rules Committee.
Good morning. Mary Fagan.
Good morning. This is Mary Fagan. I am appointed by the Governor in the nurse administrator role.
Good morning. Loretta Melby.
Hi, I'm Loretta Melby, or Lori, and I'm the Executive Officer appointed by the Board.
Good morning. Reza Pejuhash.
Good morning. This is Reza Pejuhash. I'm the board's legal counsel.
Thank you, Board President Jackson. We are ready for you.
Thank you very much. We'll move on to item 2.0. And item 2.0 will be general instructions from the BRN moderator and how we run the meeting this morning.
Good morning. This is the BRN moderator. I will be moderating the meeting. To facilitate public comment, we will be utilizing the WebEx question and answer feature. When the board reaches a point in the agenda at which public comment is appropriate, the question and answer feature will be turned on and members of the public can indicate that they would like to make a comment by inserting the phrase, "I would like to make a comment," in the question box, which is typically in the lower right of your screen. I will then call on the individual and unmute their microphone. The individual will have 1 minute and 30 seconds to make their comments. I will not give a warning as your time approaches. I will mute your microphone and will announce that your time has exceeded the time allotted. I will then move on to the next member of the public who has a comment. Please note that the question and answer feature is being used only as a means for the members of the public to represent that they would like to make a verbal comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. When asking a question, please make sure the question is directed at the host, me, in the dropdown. If any attendees utilize a profane name, they will not be called upon to prevent members of the public from being subject to profane language. While you are free to express criticism or negative views, for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. I will provide a brief reminder of this approach at the start of each public comment item. Finally, when board members or senior staff are not speaking, I would like to remind them to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder.
BRN moderator, thank you for those instructions. We're moving on to item 3.0. Item 3.0 is public comments for items not on the agenda, items for future agenda. Public comments will be limited to 2 minutes at this time. Thank you, BRN moderator. You can open up for public comment now.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Jackson, there are no public requests for comments. Would you like me to close the window? Board President Jackson?
This is Reza. I still see him in the list. President Jackson, are you there? Are you able to unmute?
Board President Michael Jackson has reached out to me. He's having difficulty trying to unmute. For some reason, it is blocking it on his computer. Mark, can you assist with that?
Board President Jackson, you're unmuted.
Yes, you can close the public comment section at this time. Thank you very much.
Thank you, sir.
Moving on to item 4.0, review and vote on whether to approve the previous meeting minutes from 4.1, March 11th, 2020, September 16th, that's item 4.2, 2020. Do I have a motion?
This is Ken Malbrough.
I will make the motion to accept the minutes as they are.
Second.
We have a first and a second. Are there any public comments relating to the meeting minutes of item 4.1 and 4.2?
We'll be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give you a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Jackson, there are no requests for public comment There was a statement said made the motion and second. Be stated again, please. They could not hear the second.
Thank you very much. You can close the public comment window now, please.
This is Board Counsel Reza Pejahech. I think it might be just a good practice and helpful for whoever's making a motion or a second, just to identify yourself by name. Whoever's taking the minutes, and for those members of the public who don't really know the board members by voice, it just may help. So I believe the first was to adopt the meeting minutes, and the second was to adopt the meeting minutes. The first, I believe, may have been, was it Betty Woods?
Yes, that's correct.
Karen
Okay.
Skelton seconded.
Got it. Thank you very much. So with that, I think we can go ahead and move to the vote.
Board BRN moderator, will you call the roll call for the vote, please? Michael Jackson votes yes.
Ken Marlborough,
Ken Marlborough votes yes.
Dolores Trujillo,
Dolores Trujillo votes yes.
Elizabeth Woods,
Elizabeth Woods votes yes.
Imelda Seha Butkowitz,
Imelda Seha Butkowitz votes yes.
Karen Skelton,
Karen Skelton, yes.
Mary Fagan,
Mary Fagan votes yes.
BRN moderator.
yes, sir.
Board member Fagan, you weren't on the board at the time for the March 11th.
Oh, yeah. So can I abstain from that one?
Yes.
Okay, let's do that.
Thank you very much. Does that conclude the vote, BRN moderator?
Sorry, yes, sir.
Okay, we're moving along to the next agenda item, item 5.0. This is the Executive Officer's Report.
Thank you, Michael. Just to give a brief update of the things that have been happening at the board. We are working with various stakeholders as we see that COVID-19 is surging. We know that our healthcare workers are exhausted. They're doing their best to continue to care for our sickest patients. Emergency rooms and ICUs are filling up. What we ask is that you guys please remember to follow all CDC guidelines, practice social distancing, wear your mask. That's the least that we can do to help out our frontline workers. We continue to be in a casual teleworking environment with the goal to have 75% of our staff working at home. We continue to watch our numbers to make sure that our processing times are not affected by the teleworking environment. And when they are, we are practicing social distancing when we bring them back into the office. I've met with NCSBN, which is our National Council of State Boards of Nursing. I have also met with CDPH, the California Department of Public Health, and we have let them know that we have over 20,000 pre-licensure nursing students willing and wanting to help. When talking about the vaccination that is becoming available for COVID, they were looking for people that could help. I said, please don't forget that that is an amazing asset that we have. Please tap into them. Please reach out to our schools, and they will be willing to help with that project. Our Bsa Audit Investigation, now called the CSA audit process. The last time we updated on that, it was in process. That has completed. On the website, you can go onto the BSA website and look at report 2019-120. that will let you guys know that out of that investigation and out of that audit process, there came 9 recommendations. One of them has already been fully implemented, and we are due to update another report to the audit team in January, hoping to clear at least 4 more of those areas. That's our goal and our wish. The remaining recommendations, we are waiting on some technological support to be able to create a database and make that accessible to the public. When we are able to find technological support for that, we will be able to move forward on that. In the meantime, our IT is working diligently with our assistant executive officer to try to find alternatives if we are unable to procure a database of some sort to get that information out to our public. The CSA Audit Investigation Report, that is report number I-2020-0027. We did have 3 areas of recommendation. I am happy to report that the recommendations 1 and 2 have been fully implemented, and that we anticipate the final recommendation be completed soon. We will be doing an annual update for the CSA audit that was done in 2016. That's number 2016-046. Once CSA has had time to review that documentation and review that annual update, we anticipate that number 3 will be fully implemented as well. And that would make it that within 6 months of receiving that report that we've been able to clear all 3 areas of recommendation. I really want to give the kind of accolades at that point to our special investigator, Scarlett Treviso. She has worked really hard with Yvonne Leonard Taps as well to get that completed. Our public information unit continues to try to improve our call times. What we've noticed is that they will be needing the additional cross-training. We are working with our licensing supervisors. They meet with them on a weekly basis, and we'll be providing training to our public information unit staff so that they can better answer the licensing questions when they're called. What we have noticed that the majority of our phone calls come from our licensing applicants, and they are calling for information. And so we're trying to do a multimodal kind of approach for that. If we can get our public information unit staff trained appropriately with some licensing information, they will be able to answer those questions for our public. And then additionally, we are looking at some technological implementations. One that our DCA IT team is working on is a progress bar that will be included in the Breeze system when they apply. And it will report out when that application with payment was received. It will also report out when the initial review is completed. They will also report out if it is being evaluated for accommodations, and it will report out if it's been evaluated with our enforcement unit, and then whether or not it has been sent to Pearson View to get the authorization to test so that they can schedule. We believe that that will help our applicants as they wait. Right now, currently, when they go onto their Breeze site to check their application status, it only says pending. We want to be more transparent and give them information in hopes that that will put their mind at ease and know that their license application is being processed and where they are in that process. Additionally, we've talked with DCA about getting what's called a Google bot that will attach to our website. It will be an interactive chat with a Google bot that is also AI, and it will continue to learn through our FAQs. It'll learn through our website updates, and it'll be able to answer some of the hard to find questions that they would go to on our website. The additional process that may come along with that, if we do choose to go that route, is it will help with our phone system as well. That phone system, they will actually go to that Google bot first, They will be able to ask that question. If they're able to get the answer without having to talk to a live person, they can then terminate their phone call, and that will give them less wait time. If after asking the question and moving forward, then it would go to a live person, and that live person will then be able to give them the more in-depth information that they're seeking. So we are very hopeful that that will help improve our customer service. Additionally, we updated our processing time website. Previously on our processing time website, it had our APRN licensees kind of clumped together in one processing time. As of yesterday, that has been separated out, and we show processing times for our nurse practitioner furnishing, CNM furnishing, CNS, CRNAs. Every single one of them have their own processing time now, and you will be able to see them updated. We do have our licensing staff coming in and working overtime and coming back into the office more often to increase productivity so that we can improve our processing times. Right now, we are underneath the statutory requirement, but our goal is to get to a 30-day licensing processing time for all of our applications. We believe that that is something that the public needs, and we will work diligently to get that done. It will, again, require some technological advances and updates within our BRIS system, so it will not happen overnight, but it is something that we are pursuing because we have listened and we have heard that these are things that need to be addressed. Lastly, MSA is still activated. It is still up and running our emergency systems. And currently we have 4,700 RNs that have been approved through MSA from out of state to come in and help us fight this battle with COVID-19. We know that people are tired. We know that it continues to rage on, and we ask you guys all to please continue to keep that at the forefront. Practice social distancing. When the vaccine becomes available, please consider becoming vaccinated, and we can get back on track in California, the nation, and the world. Thank you.
Thank you very much to our Executive Officer, Loretta Melby, for her presentation. Were there any comments from the board related to the Executive Officer's presentation? Are there any public comments related to the Executive Officer's presentation?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Garrett Chan would like to make a comment. 1 second. Mr. Chan, go ahead, you're unmuted.
Thank you, Brn Moderator. Good morning to the board. Good morning, President Jackson, Vice President Marlborough. I want to thank Executive Officer Loretta Melby for your really great report. That was very complete. I have been on the California State Auditor's website, and I see that there have been some communications back and forth between the California State Auditor and the BRN. And I would just propose that there are some activities that are happening in the community, in the nursing community right now, that might be helpful to the BRN in addressing some of the California State Auditor's findings and responses. And so I'm just wondering if there is a way to engage with the board to help with those responses to the CSA. And if there is ability for the public to help the board with the auditor's reports, what might the correct mechanisms be? So thank you very much.
Thank you, Garrett. On our website, on rn.ca.gov, on the homepage on the very bottom right, there's a link that says Executive Leadership. You can click on that. There is a phone number and an email that I can be reached at, including all of the excuse me, executive level management at the board. So if there is public that wants to reach my assistant executive officer, the chief of ledge, or a chief of licensing, or myself, they have that access. Please reach out at any point with any information. We will be happy to receive it, review that, and make additional contact if it is deemed necessary.
Bsa Audit would like to make a comment. Go ahead, Bsa.
Hi, can you hear me?
We can, thank you.
Oh, fantastic. So I just want to thank Executive Director Loretta Malby on your support in viewing our nursing students as a wonderful pool of support. Your leadership has yielded many to reach out to us in assisting those healthcare providers that are exhausted, and our students have been serving as individuals who are serving as screeners and so forth. So just wanted to thank you wholeheartedly on your support. That's it. Thank you.
Board President Jackson, there are no more requests for public comment. Would you like me to close the window?
Yes, please. You can close the window now. Thank you. We'll be moving along to item 6.0. This is Cooperative Personnel Services, DBA, CPS, HR Consulting, and this is a fee report and it's informational only.
Good afternoon, President Jackson and members of the board. At this time, CPS is prepared to present to the board on this report for the first quarter of 2020. They just need some guidance as far as to what questions you would like them to answer. They can provide more than a general overview or a general overview if that's what you prefer. So asking is if you could please email me, Matthew Yates. In your informational packet, you'll find my email address. Any specific questions you have regarding this report before December 2nd, so we can prepare that for the first quarter and then put this to a vote. That way we can have it all ready to go so that we can prepare this fee package for the legislature at that time. Thank you very much.
Thank you. Thank you very much. Is that it for item 6.0? If that's it for item 6.0, are there any comments from the board or public comments?
Michael, this is Loretta, the EO, and just so you guys are aware, in the board package material, there is a copy of the report. It was thought that to provide you guys with a copy to read and come up with potential questions and stuff would be the best bet. So please go ahead, read that report, see if you have any questions, and please send those questions to Matthew Yates so that we can have a more robust conversation about this in a subsequent board meeting.
This is Ken Marlborough. I just have a quick question. Is this email actually, I read through the packet, but I don't recall seeing an email. Is that either on the agenda or in the document?
I believe it is on the agenda item summary. Let me just verify that real quick.
Yes, it is. It's Elizabeth Woods. It is on the summary.
Thank you.
Thank you.
Shall we open for public comment?
Thank you. Please open for public comment.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Charlotte Gullip Moore would like to make a comment. Go ahead, Charlotte.
Good morning, everyone. This is Charlotte Gullip Moore. Question, I am looking at the materials provided for today's meeting, and I did not see the executive officer report. Will that be added later?
This is the board's legal counsel, Reza Pejrash. The executive officer can correct me if I'm wrong, but I believe there are no written materials for the executive officer report agenda item. That's just a verbal report that's given.
That is correct, Reza. This is Loretta, the executive officer.
Board President Jackson, there are no more public requests for comment.
Thank you
Would
very
you like
much. You could close the window now. Next item, agenda item 7.0, informational presentation to the board. 7.1, information on the scholarship and loan repayment programs for nursing students. Informational only. This will be presented. We have some background noise there.
My apologies.
Thank you. This will be presented by Karen Rozelle, Acting Executive Director, Health Professionals Education Foundation, and 7.2 pro rata. Thank you.
Karen, your
Morning.
microphone's unmuted.
It looks like, thank you very much. Good morning. My name is Karen Rozelle, as mentioned, and I'm the Acting Executive Director of the Health Professions Education Foundation. And I just wanted to spend a few minutes today to talk about the programs that we administer using registered nurse licensing fees. So $10 of every registered nurse license or renewal fee comes to Health Professions Education Foundation, and we use that to fund 4 programs. 1 loan repayment program for Bachelor of Science Nursing and 3 scholarship programs. Associate Degree Nursing, Bachelor of Science Nursing Scholarship, and Licensed Vocational Nurse to Associate Degree Nursing Scholarship. On the next slide, I just show here's the funding that we receive and how we allocate it currently for these particular programs. And as you can see from the slides, that the funds that we receive from the licensure fees, we turn around and make awards consistently every year, almost to the maximum amount. We usually have an abundance of applicants for these programs. And in fact, today is a good opportunity because this scholarship program is opening in January. So it's a good opportunity to get the word out again for the upcoming cycle for the scholarship programs. On the next slide, so what we'll do is just kind of go into a little detail about the applications that we received last year. So it's a summary of what happened in fiscal year 1920 that ended as of June 30th. And so we receive, for the loan repayment program for Bachelor of Science Nursing, we receive a high number of applications. We received over 700 applications in 1920, and we were awarded 143. Now, we do know that quite a few of the applicants historically have had issues with providing correct documentation, and so a number of them are ineligible. And we're working on that as a program. We have created a eligibility tool quiz on our OSHPED website, and so that allows people to enter in some information, answer some questions, and get information about what they might be eligible for, and hopefully not only increase awareness about these programs, but increase eligible applications. We continue to refine our online application system so that we are being more clear about the information that we're asking for, but we do see applicants who do not provide the right loan documentation information or information on employment, etc. So we're working to really reduce that. But we were able to make 143 awards. And then in the next slide, we show a little bit about our demographics, just to show who is receiving these awards. And then, because one of the goals of our programs is to not only increase access in underserved areas in California, but increase the diversity of providers that we have providing care in underserved areas. So these charts show that we really have a diverse population of awardees for these programs. On to the next slide, which is the associate degree nursing. Again, we had over 76 applications. We were able to award 12 of them out of 46 eligible. And again, the awarded amounts is typically because of the funds that we receive. Currently, we don't receive any additional funding. And so these are our licensing fees that support these programs. The next slide, again, is the demographics. Again, the diversity that we have in the associate degree nursing, as well as the breakdown by gender. Then for the next program, which is our Bachelor of Science Nursing Scholarship Program, again, we have 42 that were eligible and 16 awarded. And we have the breakdown again, and you can see the diversity in our awardees. A little more diversity in gender with this Bachelor of Science Nursing. And then the final program we operate is the Licensed Vocational Nurse to Associate Degree Nursing. We had 20 applications, of which 6 were eligible, and we awarded 5. And the breakdown that we have for the applicants or awardees in these programs. So that was just a quick summary of what we have done in the last year. But again, I wanted to emphasize that these licensing fees that are provided go to, as you can see, they are used, and we award as many awards as we can with the licensing fees that we receive, and so we're thankful for those licensing fees. And we also, again, want to mention that our scholarship programs open January 4th. So we just completed the round with our loan repayment programs this year, and we'll be making those awards first part of next year. And then we open our scholarship programs every year around January. And so we really hope that you would help us in getting the word out about these programs. We're happy to answer any questions through this email box, or that we can answer questions about applications. I can send out the link to someone here at BRN and distribute the eligibility quiz link as well. We just encourage people to consider these programs, and we thank you for the support to allows us to make these awards possible. Thank you.
Thank you very much for your presentation. So if each nurse pays $10 for their renewal fees, how much are we taking in? Is this this is every other year, correct?
Yes. So every year. So as you can see from the one of the first slides, is that if you can go back to about slide 2, that the amount that we receive is a little over $2 million each year. And again, so everybody's not on the same cycle. So that's what comes to us from DCA each year, that we're able to turn around and award to the programs.
Are there any questions from the board members?
Yes, this is Elizabeth Woods. I do have a question. Does the applicant have to go to school within California, or can they go to an out-of-state school?
They may go to an online school, but the schools have to be in California, yes.
Okay, thank you.
Yeah.
This is Mary Fagan. I have a question.
Mm-hmm.
It looks like there's about $500,000 that was not awarded in fiscal year 1920. And then there were eligible applicants who didn't receive awards. Is there ability to apply that to some that were eligible that weren't able to be awarded?
That's a good question. So what we do is we roll those over to the next year. And we try to, if there's a quick decline, then we turn around and we try to put those next in line and make those awards as quickly as we can. But what happens is that some folks, after they accept, they may decline a little bit later. And so we just roll those funds over to the next year. For example, and then you see, for example, with the Bachelor of Science Nursing Scholarship, we had some monies that we were able to roll over and award that was over and above the normal allocation.
I have a question. This is Imelda Ceja-Butkowitz.
Hi.
Hi. So what are one of the top reasons why one might not be eligible to receive the funding?
I think mostly the eligibility issues have to do with, especially with scholarship programs, they have to be able to submit proof of an accredited school, for example. They have to show cost of the school that is, they have to have costs that are associated that to receive a scholarship, and they may not upload to us the appropriate documentation for those things. And again, that's what we're really working on, to create more questions up front so that the more people are eligible as they apply, instead of finding out after they've applied that we don't know that they've submitted correct documentation until after the program closes. When we look at the uploaded documents, for example, that they've sent to us.
So is there a webinar or something posted on our BRN as to walk them step by step so they don't, fail to submit certain documents? You said something about questions and answers, but is there like just a recorded webinar as to how to process your application and not to make those mistakes?
No, we have, one of the things that we have for our programs on the website is we have a grant guide which really goes over eligibility. We also have several, typically for each program, technical assistance calls that we make time available for people to answer any questions that applicants have. So we're always available up front before the program closes to answer any questions that people have. We're also working on a webinar that we can make available on our website as well. So we're working on a variety of different resources to provide, and again, through our email, we also answer any questions so that the team is always available to answer questions. We encourage people to ask questions before they submit, and that we can walk through and help folks making sure that they're submitting the right documents.
Great. I think the webinars are a great idea, and I look forward to seeing that when it's completed. Thank you.
Mm-hmm.
This is Mary Fagan. I have another question about this slide. The allocation totals don't actually total up to the $2,143,000. Is there something that's not included there?
I will have to check to see if you're right. It may not be accurate. So I'll check those numbers.
Less than what was awarded, if those numbers are correct.
Mm-hmm. What other questions do people have? We'll check those numbers.
I know that this is Karen Skelton, somebody asked the question about whether you have to be a California resident to be eligible for these funds. Are these funds available to nurses who might come into the state from another state as a nurse, or do you have to be certified only in California?
Well, so for the scholarship programs, they have to be going to school in California or an online program that's has a California base. But they have to agree to work in a California qualified facility when they graduate. For the loan repayment programs, again, they just have to be working in California. It doesn't mean necessarily that they came from California. They have to be working in a California eligible facility.
Thank you.
Is there a board liaison that works with your organization and has an input into allocation of the money?
So and in fact, thank you for bringing that up. So we have advisory committees that they help provide outreach and also assist with some of the scoring of the applications. And so we have on our website, on our HPEF website, we have a link to the advisory committee application. And we're certainly looking for additional people who are interested in being part of our advisory committees.
Oh, I wasn't referring to the advisory committee. I know there was a liaison from the board's nursing education consultant that used to work with OSHPED for the Registered Nurse Fund.
I'm not aware of that any longer, unless they're participating in one of the advisory committees.
Michael, this is Loretta, the Executive Officer of the Board, and our NECs do continue to work in that role. Previously, I believe it was Shelley Ward, and currently it is Dr. Marianne McCarthy. And last year, I know that it was a team approach where Marianne McCarthy had a lot of the applicants that needed to be evaluated, and there was a few other NECs that jumped in to help because of the numbers. But that is the process that goes on with our NEC group.
Thank you. So how much is in the total fund at this moment?
So the funds that are listed in the allocation numbers, apologies for if it doesn't sum, but those are the funds, those are the numbers that we get an appropriation every year in the state budget for those dollars, and that is what we receive from the licensing fees.
So the money comes from the state budget. It doesn't come directly from the BRN.
It gets sent to us, but each year, in order to receive those revenues, we have to receive an appropriation in the state budget for those revenues. And so those are a set amount is allocated each year.
So only a set amount is allocated each year, but the number in nurse licensing for nurses continue to grow.
Yes, I know. And so that's one of the things that we need to evaluate periodically to determine whether that appropriation needs to increase in future budgets. But yes, we are because it comes in as revenue in the budget, we have a maximum amount that we can receive. And so that's one of the things we do is we look at the licensing fees trend to see if we need to increase our appropriation.
And there seems to be a huge disparity gap between the associate's degree program and the baccalaureate degree programs.
Yes, and these are yes, and those are allocations that from the Bachelor of Science Nursing that we allocate for those programs, and those can be adjusted. This is typically based upon number one, the number of the amount of the award and the number of applications that we received.
Because only 80 grand for associate's degree, and the bachelor's programs are receiving up to a $1.5 million.
Right.
That's a significant disparity.
And again, it has to do with the Bachelor of Science. For example, nursing scholarship, typically the scholarships have a smaller award than a loan repayment award. And so some of that is factored into that in terms of how historically the funds are allocated to the programs.
Okay, there's no loan repayment for associate's degree?
Correct.
And why is that? Because some of the nursing associate's degree programs that come from other institutions, private institutions, cost about $80,000.
I think, you're asking really good questions, and those are things that the HPEF board can consider additional adding. Typically, so it's number one, the cost of the program is higher, and also the scholarship program is given to people while they're in school, and then there's a service obligation to commit to after they graduate. Typically, those in loan repayment programs are already working. Sometimes there's a little bit of a drop off from folks who receive the scholarship, but then later on are able to complete their actual service commitment. And so those are just some of the factors that are looked at. But in terms of adding another program, a loan repayment program, that would be something that the board could potentially look at.
This is Dolores Trujillo. So I'm looking at the allocation for the Bachelor of Science Scholarship Program. Allocation was $130,000, but what was awarded was $136,000.
Correct. That was we had some carryover. So as I mentioned, if we're not able to award the full amount from a previous year, then we carry that over to the following year. So in this example, you saw that we actually probably had some carryover from 18-19.
And there was no carryover from the associate's degree scholarship?
Right, right. Again, we try to give it all away every year. And really the difference between that is usually under is because there are folks that turn around and decline their award later.
Interesting. All right, thank you.
Mm-hmm.
Are there any further questions from the board? Thank you for your presentation, by the way, today. We appreciate you coming.
Sure. Thank you for the invite.
Yeah, I have a question. Does the Board of Registered Nursing have any input as to the allocations and the programs?
Again, I believe it's through the advisory committees, and we are in the process of reactivating these advisory committees.
Is there the opportunity for maybe our president to be on the advisory committee or someone from the board to be on this advisory committee to see how the money is spent and allocated?
Certainly, and I I can send the link out and it can get distributed in terms of the online application that we have for our advisory committee. I will have to check in terms of, I thought there was a representative on the advisory committee currently, but I will certainly double check.
It just seems to me that it should be an automatic board, one of our board members on the committee, on the board, and your board. Thank you.
No, I appreciate the comments.
Are there any further questions from the board? If not, can we open it for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time is expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Paris Malouf Burry would like to make a comment. Paris, your microphone is unmuted.
Hi, thank you for that great presentation. I'm a registered nurse and an advanced practice nurse, a certified nurse midwife I live in Sacramento and I work in Davis. And with regard to the allocation of scholarships, both at the associate's and the bachelor's degree levels, I'd like to just point out that two things. First, the cost of a bachelor's degree in nursing is many times greater than the cost of an associate's degree in nursing. An associate's degree in nursing is usually achieved at the community college level. It's very affordable. I know that for myself, I was able to go to school full time and live on savings and student loans and paid my my community college degree student loans off in a few years once I started working as a nurse. And my bachelor's degree and my master's degree were both achieved through the university level, which is far, far more expensive. The other thing I'd like to point out is that there is a solid evidence-based movement toward having the bachelor's degree as a standard, not necessarily as the entry level, because again, that can increase or can create barriers to people becoming nurses. Not all communities have university programs that are within easy access for establishing their RN license. I know that for me, it was not an option, which is why I went the community college route initially and then did my bachelor's degree. But I think that it's important that we do provide ample scholarships for both for people who are first entering nursing, as well as for those who already have associate's degrees and are trying to pursue their bachelor's degrees. It's my hope that we would make the bachelor's level more easily accessible and affordable, both through funding as well as through the creation of more direct entry RN programs at the university level in the state. Thank you.
Charlotte Gula Moore would like to make a public comment. 1 second. Charlotte, you are unmuted.
Thank you. Good morning, everyone. Again, my name is Charlotte Gullat Moore. I'm looking at the fund allocations, and to my understanding, $10 is taken from our renewal of our registered nursing license. I would like to see that the fund allocations be dispersed not just to benefit those who are seeking an associate's or a bachelor's degree, but all levels of advanced degrees in nursing. So that would be including a master's degree or a DNP, especially given the fact that we have a deficit of primary care providers. We just passed a bill to allow certain nurse practitioners in certain settings to not have to be connected or required to have the collaboration under a standardized procedure related to being board certified. We should be supporting our clinicians and our nurses on every level. So I really hope that that is considered and that we will see that the funds benefit not just associate degree and bachelor degree nurses, but all nurses seeking advanced degrees.
Elissa Brown would like to make a public comment. Elissa, you're unmuted.
Thank you. My name is Alyssa Brown. I'm a clinical nurse specialist. And I want to thank you, Karen, for a very nice presentation. I really appreciate it. I have a couple things. One is, how do you let people know about this program so they can put in their applications? I have a foundation also that gives scholarships, and just getting the word out is difficult. And the other suggestion, before you answer, when you talked about the carryover on that slide that accounts for the difference in numbers. Could you add to your slides when you do this, the carryover amount, so that you won't have to be asked that question again? So thank you. Again, how do you get the word out about this? Appreciate it.
Adrian Carrier would like to make a public comment. Adrian, your mic is unmuted.
Oh, okay. Thank you very much. Sorry for my hoarse voice. My name is Adrian Carrier. I am the Director of Education for SEIU 121 RN in Southern California, and we represent upwards of 10,000 nurses and several hundred healthcare professionals. And you know, as a Southern California native, I grew up in South LA. I wanted to speak for the working class people and those people that are really have been underrepresented in nursing. 12 years ago, when I became a nurse in Oxnard, California, there were 2 out of 900 nurses who are Latina. Now, that number has just continues to blossom and grow. And in addition to serving underrepresented in the ADN programs, I mean, I think I speak for many of our members who are concerned about and want to see advocacy for expanding the ADN programs and getting, doubling the size and capacity, and really figuring out with the hospitals how to accommodate the clinical practice for those programs, because that is a continual roadblock. And I've also been an instructor as well for nursing programs, and I have an MBA. And I can say that with all the degrees I have and my experience, we have to have more money coming in, and whether that money comes from us and our licensure or other methods, there have to be some legitimate sources of scholarship access. Maybe the board can also publish, or post links to legitimate scholarship sites, because we award scholarships every year upwards of $22,000 to our members. But I mean, there just has to be a multi-pronged approach to solve this and get the pipeline moving. I mean, that's the bottom line right now, right? And I appreciate this presentation. It's very eye-opening because I myself could never find any financial aid for my ADN program. And that's where the nurses want to get back to, is supporting our local community colleges that are affordable and have those pathways to get these nurses through and get these students through to serve what we know is going to be a continual need and a very, very large need immediately. Thank you.
Irma Cooper would like to make a public comment. Irma, your microphone is unmuted.
Good morning. My name is Irma Cooper. My question to the committee is, how is this information being shared with the nursing schools in California? Because I'm really concerned about the amount of people that was not eligible. And then my second question is, I would like to see a RN from the community on this advisory committee also.
Susan Engel, would you like to make a public comment? 1 second. Susan, you're unmuted. Sorry.
Accredited programs?
Sorry, go ahead, Susan.
Can you please define accredited programs?
This is Board Counsel Reza Pejhash. I might suggest once the public comments have finished that we get the presenter, Karen, back on for just a moment to see if she has any additional comments in response to some of these questions. So I think a few people have posed questions throughout the public comments and kind of been left hanging. So, Mr. Moderator, are there any other public comments besides the one that was just made?
There are no more. I'm going to unmute Karen. Go ahead, Karen.
Great, thank you. And thank you for the questions. They're really informative to us. So I think one of the questions was around how do we advertise? We have a monthly stakeholder announcement that goes out to anyone who's interested in receiving it. We have our social media, hopefully meetings like this, that we can share the information about our programs. So we are, if there's other avenues that you think of that we can use to do outreach, we certainly would love to hear how we can increase the information that's available about these programs. I also wanted to emphasize that these are the programs that are funded through the licensing fees. OSHPAD operates other programs, loan repayment programs that, for example, some advanced practice nurses, they're not funded from these fees, but they're funded in other ways that are advanced practice nurses, for example, are eligible to apply for. So this is a segment of the programs that we offer, and there's a full range of other loan repayment programs that OSHPAD offers. Let me see, I'm trying to remember all the questions that were asked. I'm sure I probably am not addressing them all. I can, if you'd like, I can send my information or the email address that was listed here to my contact at BRN and can share that out. We certainly, I think one of the questions was around accreditation. So on our website, again, for each of these programs, there is detailed information about eligibility. And we ask that we encourage folks who are interested in learning more about our programs read that, and they can learn about exactly what's an eligible program, what is an eligible site, forms that everyone needs to fill out. And again, we're always available to answer questions if people have questions, to make sure that they are providing the correct information, because we are working very hard to make it as transparent as possible and to encourage as many eligible applications as we can.
We have another request for public comment. Would it be okay to take that one?
Yes, please, go ahead.
Mary Lopez, I'm going to unmute your microphone. Go ahead, Mary.
Hello, I'm Mary Lopez, and I'm the Dean at the College of Graduate Nursing at Western University of Health Sciences. And I would like to advocate for the master's level entry programs to be included in this offering as well. The American Association of Colleges of Nursing are developing competencies across all nursing programs for the nation. And as they do their work, they are dividing the competencies into two different levels. One level is for entry nurses, and the next level is for advanced practice nurses. When we look at the entry nurse category, they're including associate degree, bachelor's degree, and master's level entry nurses into that set of competencies. And so in this spirit, I'd like to add the entry level master's nursing programs to be eligible for this offering. Thank you.
Garrett Chan would like to make a public comment. Garrett, you're unmuted.
Thank you, Brn Moderator. Good morning, everyone. This is Garrett Chan from Health Impact. I want to echo Dean Lopez's comment about entry-level master's programs. And I just wanted to also kind of respond to Dr. Gullop Moore's interest in looking at multiple levels. But if I could clarify with you, Karen, that these scholarships are a result of legislation that was passed, because I've been looking at the Health and Safety Code sections 127975 through 128020. Again, Health and Safety Code sections 127975 to 128020, which articulates the various programs that are eligible for scholarships, et cetera. Is this you may not know this off the top of your head, but are these the sections of code that these particular programs are based off of? And then how can we consider other public comments that have been made before me in the determination of what types of scholarships will be offered? Thank you.
Karen, you're still unmuted.
Okay, I will. So yes, if those are the if those are the sections of the code that I'm thinking of, yes, many of our programs are established in statute and have specific requirements around eligibility and requirements for the program, and so that does in some ways constrain eligibility, and if I believe you're referring to the same section that establishes HPEF and its programs. Now, there are other programs that, for example, we have received separate funding for that have been established to operate with specific funding.
Board President Jackson, there are no more public requests for public comment. Would you like me to close this window?
Yes, you can close the window now. We'd like to thank Karen for coming and providing us with a presentation, and we encourage RNs in the community to get active and involved in the advisory board. We're moving on to item 7.2, pro rata presentation with DCA Fiscal Office. This is informational only.
Taylor Schick, are you present?
Good morning. Can everyone hear me?
Go ahead, sir.
So good morning, President Jackson, board members. Thank you for having me today. I am Taylor Schick. I'm the fiscal officer for the Department of Consumer Affairs, and I'm here to give an overview of the Division of Investigations allocation methodology, specifically the 2-year roll forward methodology. So I believe in the board packet there is a 2-page document that gives a rough overview of the various Division of Investigation units and the allocation method I will be discussing today. So just to give an overview, DFI is actually comprised of 3 different units. They have a special operations unit, which handles sort of internal investigations and things within DCA, and that is distributed to all boards and bureaus based on authorized position count. They also have a health quality investigation unit, and that is specific to the Medical Board of California and any allied health programs that receive their services under the Medical Board. And then finally, there's the Investigation and Enforcement Unit, and that is the one we're going to be speaking of today. That's the one that BRN, the Board of Registered Nurses, uses. And that is a allocation that's based on your actual workload. So we actually use prior year case hour volume to determine the future year allocation for the board and all users of that program. So to give a little bit of an overview, because I think it helps provide context for why we use this allocation, and this is all in terms of budgeting. So the state of California has a full cost recovery policy, which requires that certain programs be fully funded for their services. So as such, I need to allocate and fully fund the Division of Investigations costs in their budget year. So when I say budget year, what I'm talking about is the next fiscal year, which right now is fiscal year 2021-22. We're currently in 2020-21. This is the year in which I'm building the budget for the budget year. And so I'm using information, the last good year of full information, which is actually 2019-20. So we're always about 2 years removed in terms of actual workload, actual volumes, actual costs to the actual budget we're building. So I just want you to keep that in mind as we talk about this allocation process, because due to the state budget process, we have that sort of delay. So we're always looking into the future and making our best guess as to what your future costs are going to be. So stepping back, the main way we allocate the cost is using a past year workload methodology. In the packet, there's a really high level sort of description of it. And what we're really looking at is to determine the distributed cost rate of DFI's budget in the budget year. We take a look at BRN's total case volume or case hour volume from the Division of Investigation as compared to the total case hour volume that was reported for all boards and bureaus. And that is as a percentage. So in our example, if DMI had 1,000 total hours that they reported and the Board of Registered Nurses was responsible for 20,000 of those hours, their cost allocation of DFI's budget year budget would be 20%. So that's a high level how we allocate and break out the budget by all the various users of the Division of Investigation's Investigation and Enforcement Unit. What makes this process a little bit more unique is we acknowledge that we're making a best guess for what the budget should be, and we always compare what the budget was set at versus what costs were actually incurred. And there's always going to be a difference. That difference we take, and it could be a negative figure, it could be a positive figure, we call that a roll forward amount. So whatever that difference is, it could be that you use more services than what we had budgeted you for, or you actually used less services than what we budgeted for you. So we either owe you a credit or you have a debt that needs to be paid back to the Division of Investigation. We take that amount and we roll it forward along with that allocation methodology to determine the budget year budget. To give a little bit of context of why we do that, a lot of ways it's just to make sure we're always trying to more accurately prescribe the correct cost of the programs, but it also allows some of the smaller programs that may not need the investigative services of a sworn peace officer every year. Say there's a program that doesn't have a budget for DFI in 1 year, we're not going to turn that program away and say, hey, put in a budget change proposal. In 2 years, you'll have a budget that you can pay DFI for an investigation, and then you can do your investigation. We're not going to do that. If there's something that needs to be investigated by a sworn peace officer, we're going to make sure that work gets done immediately. So that program can get the services from DFI, but we're going to track those hours that they used. So why they might not have a budget for DFI in the year that they're utilizing the services, they'll ultimately be charged and pay back those costs 2 years into the future using this 2-year roll forward methodology. So that's sort of the process in a nutshell in terms of the sort of two-phase approach we take for establishing the allocation of the Division of Investigation's Investigation and Enforcement Unit's budget. On the second page of the handout, I actually provided I think it's a 5 or 6 year history of the registered nursing budget and allocation for this unit. So you can sort of see, I know it's a lot of figures, but you can sort of see we're always tracking a figure of what we budgeted the program for, what the actual costs were, and what we charged the program. So the difference between what we actually charged the program and the actual costs that were incurred is what is that annual difference or that 2-year roll forward, and that gets rolled forward into the next year. And I know that chart is in the packet, so if you have any questions about that, which I assume you might, I'm open to answer any questions you may have. But that ultimately concludes my presentation on the process. And I know there's going to be a lot of questions, so I'm open for any follow-up questions that you may have at this time.
This is Imelda Seha-Betkowitz. I just have a question. So it's divided in 3 sections, one being the BRN. So what percentage of the caseload comes from the BRN? Who has the highest volume of cases?
So of the Division of Investigation and Enforcement Unit, the Board of Registered Nursing makes up approximately, from a year-to-year basis, anywhere from 45% to upwards of 60% of the total case hour volume of that unit. That being said, you are the largest user of the Division of Investigation and Enforcement Unit.
Wow, that's a lot. So it looks like your projections are actual pretty good projections as to the actual costs and the amount charged. I mean, it's pretty close. I just have a question. I don't know if you can answer that. How can we lower the costs? And I have a second question to that is how much of those fees are recuperated? And you know, I know oftentimes we're reducing the costs. I'm not sure if you have that information with you or not. If you don't, that's okay, but that's just my question.
So I think there were two questions there. I'll tackle the first one. I'm not sure I understood the second one, but the first one is, how can you reduce your costs? Obviously, the easiest way would be to really prescribe the Consumer Protection Enforcement Initiative model of triaging cases and only sending those cases over to the Division of Investigation that require the services of a peace officer. You know, I'll be honest, I'm not an expert on the enforcement process, but from a very high level perspective, the way you could reduce costs is to reduce the workload that you send to the program. But I'm not advocating you reduce workload by just stopping sending workload that should be worked to them over there. But really, I would just suggest you look at whatever the triage model is and determine whether or not your cases can be done by a non-sworn investigator or a sworn investigator.
Yeah, we currently have a project. I'm sorry, we currently have a project program right now that we are doing that exact same thing. So my next question is, do you know approximately of the billable hours, how much is that actually not recuperated? So we often lower the fees. Do you know how much we reduce every year of the actual fees that you've incurred?
Let me try to figure out if I'm understanding this correct. You're talking about a fee. So are you asking how much has the budget potentially declined?
You know what? I think I'm gonna forget that question, but I think I've just answered my own question. Oftentimes, when petitioners come before us, we have a cost that we've incurred and we send it off to them, and oftentimes we're reducing it. But I don't know that would matter in these cases because we have to pay you regardless.
You're talking about cost recovery.
Yeah.
So I think cost recovery does, depending on who receives the cost recovery. I know in certain cases it comes in. Right now we code cost recovery. If it comes into the Division of Investigation, it comes in as a reimbursement. But because DFI is we establish the budget and it's fully allocated to all the boards and bureaus that utilize them, if they receive any reimbursement in the form of cost recovery, it actually lowers their overall expenditures for that year. So, a high-level example, if the budget is $10 million and they spend $9 million of it, normally they save $1 million, and then they bring in an additional, say, $500,000 in cost recovery, we actually discount that again, and ultimately the costs of the program would be $8.5 million, and any savings that were achieved get distributed back to all the programs that utilize the services of the Division of Investigation based on that same allocation method that we established the budget at. So without all of the complicated phrasing, if you receive cost recovery, it ultimately lowers the cost of the division of investigation.
It goes towards the BRN or goes in the general fund.
So it depends. We have two pockets. If you get cost recovery, depending on who it's ordered to, it's either being recouped on the investigator work side or to the BRN, to your side. So if it gets recouped to BRN, it's a reimbursement to your fund. If it gets recouped by DFI, it's a reimbursement against their budget, which ultimately then benefits your fund as well. So any cost recovery ultimately will benefit the programs that utilize the program by essentially saving money in terms of expenditures for all the programs.
Thank you.
Are there any further questions from the board members? If not, we'll open it up for public comment.
Before I proceed, Taylor, I'm going to leave you unmuted. Is that okay, Board President Jackson and Council Reza Peziash?
This is Reza. That's fine with me. Sure.
Me too.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing in the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Jackson, there are no requests for public comment. Would you like me to close this window?
Yes, please. Thank you very much. That concludes item 7.2. We're going to move along to item 8.1 and 8.0. This is the report of the administrative committee. And 8.1 will be discussion and possible action regarding board and committee dates for 2021. In the previous board meetings, Reza, can you correct me if I'm wrong, but we had made a decision regarding meeting dates before.
I believe we made a motion to grant flexibility during the pandemic to reschedule things if needed. I'm not sure what else we may have done that you might be speaking of.
Michael, this is Loretta, the executive officer, and this is the first board meeting that we have included 2 alternate calendars for discussion and vote. There is one calendar that has the board meeting 4 times in a year with 4 committee meetings as well. And there's another calendar that has 5 board meetings a year with 5 committee meetings. the 4 committee meeting and 4 board meeting a year meets the statutory requirements. We would be in compliance with that. The 5 board meeting and 5 committee year is what we originally scheduled for this current year that we're finishing out. But this does not include the special board meetings that are added to the calendar.
Did the board members have a chance to look at options 1 and 2 in the packet?
This is Imelda Ceja-Betkowitz. I'm looking, I have reviewed them. I have kind of reservations. It seems like, you know, we often have a lot of things to cover. And by cutting them short, I'm afraid that we might not be able to cover all our business. If we do option 2, can we put something in the language that, you know, we could always cancel if we don't need them. I'd rather put them on the calendar, and if need to, we can cancel them. But of course, we would have to put something in writing or make that very clear. Again, my concern is that we often have a lot of things to cover, and I'm not sure that by cutting the dates is going to help us any.
We can always add a board meeting if necessary.
You can always delete a board meeting, I think, if we put it in writing. The flexibility.
You want to make a motion to have flexibility, or giving the administrative committee and the executive officer flexibility to schedule or cancel board meetings. That's what we did previously for the pandemic.
Yeah, we could do that if we go with the option 2, you know, and have all the regulars scheduled as we have in the past, and we could have that same flexibility. Again, I'd rather have them on there and you know, have the flexibility of canceling them if we have no business to take care of.
Is that your recommendation?
I want to hear from other board members. Open for discussion.
Other board members?
This is Ken Marlborough. I'm actually leaning towards option 1, and I think, again, if we need to add, there is that possibility of doing so.
This is Dolores Trujillo. I'm also leaning toward option 1.
This is Karen Skelton, and I am as well.
Well, can we have a motion?
This is Ken Marlborough. I would like to move that we adopt option 1 for our 2021 meeting schedule.
I'm sorry, before the second, this is Reza, legal counsel. So there was some discussion of granting, I think it was either the board president or the administrative committee members discretion to add or cancel meeting dates as needed if circumstances require. Is that going to be part of the motion or subject to a separate motion if the board wants to go that way?
Can you include that in your motion, Mr. Marlborough?
Yes, sure. I'll restate my motion. I'd like to support option 1, but also give the administrative committee the flexibility to add any meetings as necessary.
This is Mary Fagan. I'm wondering if for the meetings as necessary, if it would be possible to identify dates just to be able to facilitate scheduling. that, TBD, whether we would have it, but if we did, this would be the date. Is that a possibility?
Well, when we have emergency situations arise, we don't know.
Yeah, this is Reza. I think what generally happens if an unplanned meeting needs to be scheduled is that staff would get board members' availability beforehand to try to settle on a date that works for as many people as possible.
I second Kenneth Marlborough's motion. Are there any further discussion from the board members? Hearing or seeing no further discussion, we'll open it up for public comment.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Jackson, there are no public requests for comment. Would you like me to close the window?
Yes, close the window and we can do a roll call vote.
President Jackson?
Yes, please.
I just had a quick question. I noticed that each meetings on the examples were all teleconferences, and so, which I'm not complaining about, and I think they probably should be, but does this mean if we vote on this and say something does change where teleconferences we may be to do in-house, we cannot do that due to this vote, or does that can be flexible as well?
I think that could be flexible as well. Am I correct, Reza?
That's a good point, Ken. I think that if under the discretion that's being given to the admin committee members in case circumstances change or require as to dates, I think that could also include changing the format of the meeting. If, for example, the governor's executive order about conducting these types of teleconferences changes or something like that. So, I mean, obviously, if we lose authority to do these types of meetings, then we would go back to conducting in-person or teleconference meetings under the existing provisions of the Open Meeting Act. So, yeah, I think there's already room to change things if needed, including the format of the meeting.
Okay, thank you very much.
Continuing on with the vote, Michael Jackson votes yes. BRN Moderator, will you do a roll call vote, please?
Ken Marlborough.
Ken Marlborough votes yes.
Dolores Trujillo.
Dolores Trujillo votes yes.
Elizabeth Woods.
Elizabeth Woods, yes.
Imelda Ceja-Buckowitz.
I'm going to vote no.
Karen Skelton.
Karen Skelton, yes.
Mary Fagan.
Mary Fagan, yes.
This concludes our vote. Board President Jackson.
Thank you very much. Moving on to the next. Before we move on, do the board members need to take a break for comfort or bathroom break or something right now?
Yes.
Shall we
Yes, please.
Can we come back at 11 o'clock, please?
Sounds good.
All right, thank you.
Okay, we'll pause for a break. We will return at 11 o'clock. It's 11 o'clock. Are we ready to reconvene?
Skelton here.
Woods here.
Trujillo here.
Michael Jackson's back.
Marlboro's here.
And Mary Hagan.
Imelda's here.
Thank you and welcome back.
Brn Moderator, have we established a quorum?
I'm sorry. We are ready to reconvene. Michael Jackson.
Thank you very much. We'll move on to item 9.0. This is report of the Nursing Practice Committee. It will be chaired by Elizabeth Woods, our advanced practice nurse. Thank you.
Shall I begin, Michael?
Yes, please.
Okay. This is Elizabeth Woods, and I chair the Nursing Practice Committee. And could I have the other members of the committee please introduce themselves?
Betty, this is a board meeting at this time. So
I don't have to do it at this particular time. Is that what you're saying, Michael?
yes.
Okay, thank you. Okay, and Jeanette Wackerly is on the meeting. Is Jeanette here?
There, I'm unmuted. This is Jeanette.
Jeanette, you're unmuted. Yes.
Thank you. I'm here.
Okay.
This is Jeanette Wacker.
Hi, Jeanette. Thank you.
How you been?
This meeting will be a bit long today because there's a lot of things that we have to discuss and get information about, and then possibly have some actions on it concerning various regs and bills that have been passed. And they all center around advanced practice, mostly nurse practitioners and clinical nurse midwives. So the first one is item 9.0. The first discussion and possible action that we will have is 9.1, clinical practice experience required for nurse practitioner students enrolled in non-California-based nurse practitioner education programs. So Jeanette is the nursing educational consultant, and she will be taking us through this particular discussion.
Thank you, Betty.
Jeanette.
As you may recall, some of the board members that were here through the last board meeting, it was last year that the regulations for nurse practitioners were completed, and within those regulations is a section called CCR 1486. It requires non-California-based nurse practitioner education programs provide evidence to this board that ensures that students have successfully completed prerequisite courses and are enrolled in non-California-based nurse practitioner education programs. And within the regulations, it's a requirement that the board approve schools who are requesting to be recognized in California as out-of-state online nurse practitioner education programs. And you will see that you have Columbus University, Drexel University, Marysville University, Simmons University, and St. Augustine University. You have a directory in the second page of this document, and then you have the regulations, which we checked off as all the programs meeting The exception is that we're awaiting board approval for the mentioned programs. I guess I should talk louder. Can you all hear me? So the request of the practice committee is that the board consider the approval of Columbus University, Drexel University, Marysville University, Simmons University, and St. Augustine University as out-of-state online programs recognized by the California Board. That's the end of this particular.
Are we back that we can hear one another?
That was my report. Do I need to repeat anything?
I didn't hear any of it because all of a sudden everything went blank. Was it just me that was not connected, or did we have a problem?
I was able to hear her.
I was able to hear.
Yep, I was
This is
Sorry.
Malcolm. I was able to hear as well.
Well, it must have been me. So, Jeanette, I'm sorry for the inconvenience, but would you give your report? Because I think we might have to do some kind of an action on this.
I would be happy to repeat it.
I'm sorry about this.
That's fine. The practice committee is requesting of the board to approve non-California-based nurse practitioner education programs. There is the California resident RN who is attending these out-of-state programs. And it was a year ago that regulations were passed that specifically address the fact that the Board of Nursing must approve out-of-state online nurse practitioner education programs for students who reside in California and are attending these programs. We have Columbus University, Drexel University, Marysville University, and Simmons University, and St. Augustine University. So the request from the practice committee is that the board take into consideration the approval of these schools for the continuation of education in California for RNs licensed in California.
Thank you, Jeanette.
You're welcome.
And yeah, there's a lot to these programs, and Jeanette has been updating me on these various programs, and I don't see any reason why we shouldn't approve of them. So I would like to make a motion to approve them. Do we have a second?
This is Imelda Seja-Bedgood. I will second your motion, Betty.
Thank you. Any discussion from the board?
Generally, this is Karen Skelton. Generally, I think this is a really good idea for all of us to approve. That's my comment.
Thank you. Do we have any other comment from the board?
No other comments from the board. We can open it for public comment.
Thank you.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for the members of the public to see how they should type their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Elissa Brown would like to make a comment. 1 second. Elissa, your microphone is unmuted.
Thank you. Alyssa Brown. I'm an advanced practice nurse, a clinical nurse specialist. My question, comment is if you vote on this, does it mean that any other programs are not included? Or if the programs come to light, you're going to have to revote to approve those programs because there's many programs across the country. Thank you.
We've been doing the various programs as they come in, is my understanding, Jeanette. Is that correct?
That's correct. We have an application process that all programs that are interested in being approved by California, they submit the information to us based on an application process. When that application process is completed, then it's brought, the individual schools are brought before the practice committee. And today, the practice committee is sending the schools that we have the information on to the board for approval. So it's an operational process that's been going on. This is the second time the board has looked at out-of-state online nurse practitioner programs. The first group was probably 11 schools, and this is 5 schools. So we are in the beginnings of schools asking us to approve them for being an out-of-state online nurse practitioner program with California residents. So to answer your question, they have to apply to the board to be recognized as an approved program. If that helps, Alyssa.
Board Member Woods, we have no more requests for public comment. Would you like me to close the window? Betty? Board Member Woods, do you hear us?
You want to try unmuting her mic?
Betty, can you hear us?
Hello?
There you go.
Yes, I'm back here. For some reason, I keep going on and off, and I hope I've corrected the problem, but hopefully.
Okay, we have no more public requests for comments. Would you like me to close the window?
Yes, please. Okay, can we continue with our vote on this, please? Am I on? Is anybody hearing me?
We hear you, Betty.
BRN moderator, can you call the roll for vote, please?
Board President Michael Jackson?
Abstain.
Kenneth Marlborough?
Marlborough votes yes.
Dolores Trujillo?
Dolores Trujillo votes yes.
Elizabeth Woods?
Woods, yes.
Imelda Seha-Bukowitz?
Imelda, yes.
Karen Skelton?
Skelton, yes.
Mary Fagan?
Mary Fagan, yes.
This concludes our vote.
Okay, thank you very much. And let's move on then to 9.2. This is discussion and possible action on the Advanced Practice Registered Nurse Advisory Committee. And they will present a statement on the implementation of the Home Health Care Planning Improvement Act and the communication of such guidance for public posting on the board's website. And Jeanette, we have somebody who's going to be presenting.
I want to introduce, yes, the chair of the advanced practice group here for the board. Eric, is he on? Mitchell, is he on?
Mitch, are you there? Sorry, hold on. Let me try the other one, Mitch. Hold on.
Hold on.
Mitch, are you there?
I am.
Okay, there you go.
Good morning, board and members. Thank you very much for allowing me to present this. So this specifically relates to the board's website under the Forms and Publications section, subsection Publications, subsection Practice, and subsection Advanced Practice Information. It's the intent of the APRN Advisory Committee to address advisories on the board's website that are either outdated or and require revision or are not applicable any longer and should be taken down, or are new. And in this particular example, this is a new advisory. And this relates specifically to a provision in the CARES Act, which, and it's actually a two-part issue, which essentially extends the ability of non-physician providers, which are inclusive of physician assistants, nurse practitioners, and clinical nurse specialists, to certify and recertify home health care services and associated needs to patients. And this was specifically to address the deficits that are the obstacles created by COVID in terms of the California public and also across the nation. Originally, it was a termed provision, but now it has been authorized permanently, and we would like to have an advisory placed under the section I already described as it relates to eligible APRNs. I will say that under the current public health emergency declared by the governor, DHCS had requested that CMS grant some flexibility to extend this to all advanced practice registered nurses under the state plan amendment 20-0024 that temporarily allowed all licensed non-physician practitioners to prescribe home health services during this public health emergency. However, just of note to the board, certified nurse midwives were not included under the CARES Act, but are currently under this public health emergency provision included. Once that provision expires, whenever that occurs, then clinical nurse specialists will no longer be eligible under the state plan amendment and or the CARES Act. So the language that we are requesting in terms of advisory to the public and licensees is that eligible APRNs are able to certify and recertify home health services using a standardized procedure under existing regulation. And I am open to any questions from the board.
This is Betty. Jeanette, before we go on for any questions, do you have anything to add to this?
No, I think he stated it perfectly clearly that during this state of emergency, we have all APRNs, that is nurse practitioners, nurse midwives, and CNSs for the categories that provide primary care are going to be able to, for their patients, order home health and have it paid for. I think that's the real issue, is that this is now going to be a funded ability for these nurses to have their patients have home health. And so this will change what he's talking about. It will change after the state of emergency is lifted by the governor. Then it will just include nurse practitioners, clinical nurse specialists, and the midwives were not included in this particular CARES Act as primary care providers. Did I state that correctly, Eric?
Yes, that is correct.
Thank you.
So we could deal with that at another time, but this is just to hold us over for this crisis.
Correct, yes, because under existing statute, the standardized procedure is required for this because it's based, CMS requires it under whatever the existing statute is in the state where this is applicable. And until such time as AB 890 is implemented, that is the existing statute.
Okay,
Yes.
thank you.
So the practice committee is going to request the board to approve the posting of the CARES Act that pertains to home health services. You put on the board's website, and through the APR committee, the group there will produce the documents.
I make a motion that goes forward. Any second?
I second your motion. This is Michael Jackson.
Thank you. Any discussion from the board?
Sorry, this is Reza. Can you just be clear on what the motion is? That just spell out what it is.
Do you want me to restate it, Reza, or?
Yes, please.
So eligible APRNs are able to certify and recertify home health services using standardized procedures under existing regulation.
And that it would be published on the board's website.
Correct, under the section that I outlined, which is the subsection of advanced practice information.
So that what you just read would be the actual language of the advisory?
Yes, and I would provide the links, obviously, to the associated regulation.
Okay, thank you.
Since it's temporary, this is Karen Skelton. Since it's temporary, do we need to state that or state a tied to the crisis or anything like that?
I can provide the links to each of the applicable provisions under the declared state of emergency, as well as the links to the CARES Act and the home health, home health, what is it? And then also as it relates to DHCS and their existing language, which is, as I mentioned, the state planning amendment 20.0024.
This is Jeanette. I think that we're understanding is that these will be hot links. In other words, the public will be able to hit that link and go directly to the authority that he's referring to. So if you're interested in what the language actually says in real time, you can do that.
That is correct. And I think that would answer the board member's question regarding the temporary nature of parts of this provision.
Any more comments from the board? Then can we go to the public to see if there are any comments or discussion, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for the members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Garrett Chan would like to make a comment. 1 second. Garrett, you're unmuted.
Thank you. I'd like to thank Mitch Erickson and Betty and Jeanette for your hard work on this. I'd just like to respond to Board Member Skelton's comment. And perhaps if I state it this way, it might be understood in a different way. With the passage of the Federal CARES Act, nurse practitioners and clinical nurse specialists now permanently can order and recertify for home care services. Temporarily, certified nurse midwives can do that until the end of the declared emergency. And so it is my understanding that Mitch wants to write an advisory stating those facts. One, that nurse practitioners and clinical nurse specialists now permanently can order and recertify home care services pursuant to standardized procedures of the Nurse Practice Act and the CARES Act at the federal level, and that temporarily certified nurse midwives can do certify and recertify home care services for the duration of the declared emergency. So I just wanted to clarify that point, and perhaps if I'm saying it this way, it might be more clear. Thank you.
Thank you.
Alyssa Brown would like to make a comment. Go ahead, Alyssa.
Hi, thank you very much. And thank you, Betty, Jeanette, Mitch, and Garrett for clarifying. And I'm sure most of you know, the process up until now has been for essentially the nurses fill out the form and they have to wait for a physician to certify, which delayed care to patients. This will improve access in a timely way. And hopefully one day, the certified nurse midwives will also be included. They had been included in the original congressional bill and eliminated in this one. So thank you all. I think this will be really good for nursing and for the patients.
Kathleen Belzer would like to make a comment. Kathleen, you're unmuted.
Thank you very much. I am a certified nurse midwife. I was the president of the California Nurse Midwives Association until very recently. I want to thank Mitch for bringing it to our attention that we were not included in the CARES Act. And I am very happy that right now there is a state amendment that includes us. I think it was an oversight that we were not included, but there's perhaps nothing to be done now. But now that we have an independent scope of practice without physician supervision, I think going forward, it is going to be extremely important that we have the ability to order home care. And I think for certified nurse midwives and maternal health, this is often used for well baby checks, lactation support, and maternal checks for postpartum depression. So I'm hoping that somehow this can be addressed. And especially now, as of January 1st, that we will not need a physician to be involved in our care if we are in that independent low-risk scope. And those are certainly the women that will need these services. And we often care for, I will say, low-income women. And this patient demographic is very, needs these services very much.
Paris Malouf Berry would like to make a comment.
Nurse Midwives Association, and I want to thank Mitch as well, and thank Garrett for pointing out that we are included at least to a certain extent. And I echo Kathleen Belzer's comments in that this ability to provide home health care services is incredibly important, especially to those folks who have limited income capacities. And I look forward to us working with the state, with the BRN, with our legislators, and all of the other important stakeholders to make sure that we have the permanent capacity to authorize home care and home health services. Thanks.
Chairperson Woods, there are no more other public requests for comments. Would you like me to close this window?
Yes, thank you.
Elizabeth, if it's possible, I just make one more comment to the board in reference to this item, which is that I very much appreciate the lobbying efforts of the state certified nurse midwifery board to or organization in terms of its federal lobbying efforts to have an amendment made to the CARES Act at a future date. But the Medi-Cal regulation is currently being revised based on the alignment with the current language of the CARES Act, and hopefully they would be able to expeditiously amend that once the federal nurse midwifery organizations are able to work with the federal government or CMS to make that future amendment.
Yes, I hope that will happen. And thank you very much, Mitch, for your presentation. And I would like to go to the vote now.
BRN moderator, you want to call for the vote? Roll call vote. Michael Jackson votes yes.
I'm sorry, Ken Marlborough?
Ken Marlborough votes yes.
Dolores Trujillo?
Dolores Trujillo votes yes.
Elizabeth Woods? Betty?
Woods, yes.
Imelda Sejapakowicz?
Imelda, yes.
Karen Skelton?
Skelton, yes.
Mary Fagan?
Mary Fagan votes yes.
This concludes our vote.
Thank you. And we can move on then to 9.3.
This is Jeanette, excuse me. And it is also Mitch that wants to report on this agenda item regarding workforce survey.
Great. Mitch will be reporting then on the APRN Advisory Committee request that the board's next workforce survey is inclusive of all APRN's professionals, and that the committee has the ability to review the survey and make recommendations to the Nursing Practice Committee in advance of the survey's launch in June 30th, 2021. Mitch?
Thank you again, board members. So this was actually a fairly straightforward request that when the board proceeds to approve the launch of the next survey, that the previous years were not fully inclusive of all advanced practice registered nurse professions. And we just asked that it be extended to all of them, which would include the NPs, the CNSs, the certified nurse midwives, as well as the certified registered nurse anesthetists. And the committee is requesting that we have an opportunity to weigh in, review, and make recommendations to Nursing Practice Committee in advance of that launch to ensure the integrity of the survey as well as its full representation of the advanced practice registered nurses that the advisory committee represents for the state of California.
And do you have that exactly how you want it presented? That's how we'll be doing it?
Oh, sure. A motion. Yeah, the motion would be that the API. Go ahead.
No, go ahead. I wanted to hear the exact phrase.
Sure. The APRN Advisory Committee wishes to participate in review and making recommendations to the Nursing Practice Committee for workforce surveys inclusive of all APRN professions that are licensed under the BRN.
Betty,
I will make the motion.
Now, Betty,
Yeah.
this is Michael. The The survey is something that's conducted by the BRN.
Yes.
That's a survey conducted by the BRN. This is not needed. And my motion is going to be to vote no on it.
So Michael,
Give more of an explanation, Michael.
They can add the APRN groups to the survey that comes up. They don't. We don't need feedback from the committee on the questions that need to be asked for the survey that's conducted by the BRN.
I'm not sure what you're saying, that we can just do this without voting on it, or?
This is Reza, the board counsel. I wonder if I could ask a question or possibly even help. So if I'm understanding correctly, this is the survey that currently, is it UCSF that does the survey?
Mm-hmm. Yes.
Research on our behalf? Okay. Mitch, is the proposal for the APRN Advisory Committee to, because this survey is conducted by a university on the board's behalf, is the proposal to have the committee kind of weigh in on the criteria that are given to UCSF or the contractor prior to that survey being conducted by the contractor?
So thank you for the question. So the two provisions of the ask are that the survey that the BRN administers from the board, that it be inclusive of all APRN profession groups, which it had not in the past. And second, we would be happy as an advisory committee, given our mandate, to with the permission of the practice committee, to communicate directly with the vendor that the BRN has established a relationship with to do the survey, versus providing that information directly to the nurse practice committee, if that's Chairperson Jackson's opposition.
And Mitch, while you're presenting this, who do you work for?
I don't work for, I am retired.
You don't work for the University of California, San Francisco anymore?
I do not.
Okay, just making sure. So the Reza, the advisory committee, has it even been established yet?
Well, we have a current advisory committee that was established on an ad hoc basis.
I'm talking about the new one that's going forward. We haven't established that yet either.
All right, we haven't established the one that was mandated under AB 890. We'll be talking about that a little bit later, I think, today, but that's correct.
So I think until we establish that, we take we don't have to take any action right now on item 9.3.
Could I ask then that the motion be a single item, which is that at least for the next planned workforce survey, that is at least inclusive of all APRN professions that are licensed under the BRN.
And that doesn't require a motion. Betty can just give direction to Loretta to include that.
Okay, that's totally acceptable. Thank you.
I will do that if we can just do that with just by me saying that we can do it.
With Jeanette and Loretta, Betty.
I will be glad to do that.
I would suggest making that just a quick motion, being that we're directing the contractor to take additional data beyond what's in the statutory requirement.
I think that, this is Jeanette, may I say something? I
Yes.
think it would be clear to identify the 4 advanced practice groups for us to identify that they would be included in the next advisory, or I shouldn't say advisory, I should say the next
Workforce survey.
survey, yes. Period.
So Reza, you're saying we need to have some type of a vote on this and not give me permission and Jeanette permission to move ahead with it?
Well, I think that the vote would be to have you and Jeanette or whoever to work with the next appointed contractor for the next upcoming workforce survey. I mean, the motion would be to basically grant Mitch's request to include the certain specified APRN groups in the next workforce survey.
So Chairperson Jackson, that would essentially pass the board, is what you're suggesting, is that they would simply have the authority to reach out to the vendor and just be inclusive of the other APRN professions?
Giving direction to the EO and the liaison is a responsibility of the chairperson and the chair of the board.
This is Loretta, the executive officer, and just so you guys are aware, our contract, our current contract is good until June of 2021. So I just wanted to throw that out.
So I'm still unclear what the motion is going to be here, or what we're, possible motion is. Reza,
My suggestion, yeah, this is Reza. My suggestion would be just a quick motion to have the next APRN, I'm sorry, the next workforce survey include the collection of data on APRN categories, the four that Mitch can identify.
Yes, the motion would be that the workforce survey contract would be inclusive of all four APRN professions identified as clinical nurse specialists, certified registered nurse anesthetists, nurse practitioners, and certified nurse midwives.
I make a motion that we accept that. Do I have a second?
I second it.
Any discussion from the board members? I don't see or hear any. Any discussion from the public, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should submit their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Paris Malouf Burry would like to make a comment. Paris, you're unmuted.
Hi, thanks for recognizing me. I want to take a moment to thank Mitch for this innovative recommendation. I think it is really important to include all advanced practice registered nurses in the workforce survey. I also want to speak in support of his recommendation that they work directly rather than going through every step in the bureaucratic channel. I hear Chair Jackson saying that that's not necessary, but in my experience with BRN matters as as a nurse, as an advanced practice nurse, it seems that things do tend to move very, very slowly. And I just want to share my support for ways to streamline processes and help things to move a little bit more quickly. And in respect of each of the members' very busy schedules and all of the time that they put toward this work. Thank you.
Alyssa Brown would like to make a comment. Sorry. Alyssa, you're unmuted.
Thank you. Thank you to everyone, and Mitch particularly for bringing this forward. I think it's absolutely necessary that if we're really looking at the workforce and the APRN workforce, that we have to include all four. So I appreciate it. It would be nice about streamlining, but or looking at the process at least to make it happen in a better way. So thank you very much.
Chairperson Woods, there are no requests for public comment. Would you like me to close this window?
Yes, please. Okay, this is Betty again, and I would like to take a vote on the motion as put forward by Mitch. Do I have a second? I think you already did. I think we had a second from
We
Michael.
already have a first and a second. We're calling for the vote now. BRN moderator, can you call for the vote?
Thank you. Michael Jackson?
Yes.
Ken Marlborough?
Marlborough, yes.
Dolores Trujillo?
Trujillo, yes.
Elizabeth Woods?
Woods, yes.
Imelda Seha-Butkowitz?
Seha-Butkowitz, yes.
Karen Skelton?
Skelton, yes.
Mary Fagan?
Mary Fagan, yes.
This concludes our vote.
And the motion passed. Let's move on to then 9.4, discussion and possible action regarding Assembly Bill 890 and how it will be implemented. And it's going to be implemented January 1st, from what I understand. Jeanette, somebody is presenting on this?
Yes, Patty Gurney should be on the line, and she's the president of the California Association of Nurse Practitioners. So check to see if she's on the line to speak to this.
Yes, here I am. I'm online. Hi.
Thank you.
Hello, good morning. Thank you so much. I want to thank the BRN for the opportunity to speak to you today. The purpose of AB 890 is to improve access to high quality and safe patient care to people living in California. As one of the statutes, Business and Professions Code Section 2837.100 states, it is the intent of the legislature that the requirements for nurse practitioners shall not be an undue or an unnecessary burden to licensure to practice. The requirements are intended to ensure that the new categories of licensed nurse practitioners have the least restrictive amount of education, training, and testing necessary to ensure competent practice. I'd like to just go over the new section of the Business and Professions Code that seek BRN action and give the CNP perspective for the consideration of the BRN. You have a document there that was put together by expert consultants in consultation with our own experts and health impact, and I want to thank Garrett Chan and Susie Phillips also for their contributions to making that document. I'm going to briefly go through some of the main issues that are raised in this very complex bill. The first one has to do with the Bpc Section 2837.101C, transition to practice. This is regards the regulations defining minimum standards for the transition to practice. CNP requests that the BRN consult with nurse practitioner experts in transition to practice when creating these regulations. Again, it is the intent of the legislature to not unduly burden NPs in the transition to practice. Next, the Bpc Section 2837.102 with regards to the formation of a new NP advisory committee. The new law directs the board to establish a nurse practitioner advisory committee to advise and make recommendations on all matters related to nurse practitioner practice. CNP requests that diversity be a factor in constituting the NP advisory committee. We need subject matter experts with diverse experiences such as, but not limited to, hospital and health systems, education, small clinics, NP entrepreneurs, different population foci, and ideally a range of races and ethnicities. This also, we want to point out that having diversity on the advisory committee will help for input on practice situations and issues of different NPs should any disciplinary action be considered. With regards to the composition of the board, we request that we have 2 physicians and surgeons who've demonstrated positive experience working with NPs to provide guidance to other physicians and surgeons to show the possibilities of working together. And then the next section has to do with the formation of the 2 new categories of NPs, referring to the sections, Section 2837.103 and Section 2837.104, the formation of 103 NPs and 104 NPs. We just would like to recommend these 2 sections are likely already covered by Title 16, Section 1480Q and Section 1482A2. CANP recommends using already existing regulations and the BRN nurse practitioner application process to fulfill the requirements that are specified in AB 890 for these 2 categories. With regards to the 104 NP practicing in good standing for 3 years, and that's Section 2837.104B1C. There's a section, the board at its discretion may lower this requirement for a nurse practitioner holding a doctorate of nursing practice based on practice experience. CNP supports the recognition of hours gained in the course of a DN program to lower the number of years an NP needs to practice with a license in good standing and asks the BRN to create guidance around this topic. We'll also be happy to provide input and guidance as the regulations are developed. The next section had to do with the direction for the supplemental exam. This is Section 103A1A, Section 105A1, and Section 105A2. CNP has done a preliminary review of national board certification exams and has found that the national board certification exams cover all activities in the NP scope of practice defined in the law, with the exception of certifying for disability in California and delegating to medical assistants. NPs have had for many years the ability to delegate to medical assistants and have certified for state disability. We do not recommend creating a supplemental exam for these 2 activities. The next item will be the prohibition against the self-referral in Section 650.01. And we just want to state that we agree NP should not self-refer and should follow the process for disciplinary action in the Business and Professions Code 805. That the BRN look to other boards and bureaus within the Department of Consumer Affairs to see how these boards and bureaus handle the prohibition against self-referral and disciplinary action. And that's all I have.
This is Betty. I'm not sure exactly what you want us to do with all this. There's a lot of information that you've presented, and how do you want this moved to what?
So the request is that at each step of the way, as I said, the board has been directed to create many regulations around each of these items. And so CANP is
I've lost whoever's speaking.
Can you hear me now? Hello? Can you hear me?
Patty, this is Jeanette. I can hear you. I don't know.
I can hear you.
Elizabeth can.
Can you hear me?
Betty, can you hear us?
Can you hear me?
We can hear you, Patty. Hold on one second.
Okay.
Betty, are you there? Betty, are you there?
Yes, I am, but I lost for a moment, a minute or so, whoever was speaking. I lost that whole communication. My question is, what kind of motion do you want over this whole presentation that you gave? It's a lot of information.
Right. The main, at each step of the way, for each one of these items that the board has been directed to do, CNP is offering advice and asking that NP experts be included in that process. So that first item, if you want to translate for the transition to practice, we request that the board moved that we have nurse practitioner experts to formulate those transition to practice regulations. For the NP Advisor Committee, we would request that the board move to include diversity in each of those areas that I spoke of. With regards to the composition of the board in the positions, that the board move to include
Jeanette,
positions.
maybe you can assist with this somehow.
You can't hear her. She's making points right now, Betty.
This is Board Counsel Reza. Betty, first of all, let me just confirm, are you able to hear the presenter?
Who are you talking to, Reza? I can hear
I'm
her.
talking to Betty. I can hear her just fine. I just want to make sure that Betty is hearing the presenter and can hear me. Betty, are you there?
So I'm just going to ask, can you hear me?
I can hear you.
I don't think Betty can hear. This is Jeanette.
Okay, we'll give her a sec. I guess wait for
Betty, can you hear us?
Yes, I can now.
Okay.
Yeah.
Okay, so again, this is Reza, legal counsel. So I think that they made several suggestions. The implementation of AB 890 is something that's going to take place over a period of time, naturally, and they're just asking that we keep those things in mind as we implement the various pieces of AB 890, and that they are willing to collaborate as we do that. And we'll be talking a little bit later about certain elements of what need to be done to implement AB 890 as a later agenda item. And as I said, it's something that's going to be taking place over some time as regulations are formed, and there's a 3-year time frame for the workforce survey. Yeah.
Transition practice.
Does that make sense? So I don't think she's necessarily asking for any specific motion at this time, and correct me if I'm wrong, but I don't think there's a specific action to take right now. It was just. Okay, thank you.
It's information only, and we'll be discussing this obviously down the road someplace.
Right.
Is that my understanding?
Yes, so information and also an offer for assistance and help and input, expert
Right.
input as the process continues.
To do an action right now on it, because this is something that's going to take place over time. And there's various different parts of it. Okay.
Correct. And the applications are, for this new advisory committee aren't even out yet. So.
Okay. Any comments or questions from the board?
No, there's no comments or questions from me, Betty. The Reza pretty much summed it up in what we need to do.
Do we need to go to the public since it's not going to be a motion?
You can offer public comment.
Yes, I would like to, please.
We'll be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for the members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Mitchell Erickson would like to make a comment. Go ahead, Mitchell.
Thank you, board members. I have 2 comments. One is the language of this agenda item specifically stated how it will impact the APR in advisory committee, and I did not hear anything about the impacts on the APR and advisory committee. So if someone, after I finish speaking, could clarify that. The second is in regards to the provision for perhaps a distinction between transition practice for DNPs versus master prepared nurse practitioners. And I do have some concerns around the clinical hour requirements, secondary to the fact that I am in a DNP program currently, and there are part of my cohort of students, there are 3 who have transitioned directly from their master's program to become an NP directly into their DNP program, and so have 0 practice hours other than that within school. So there are none after that. And that's my only concern around how that that sort of guidance is provided through the practice committee to the BRN board. Thank you.
Would you like me to comment or answer to that question? Thank you so much, Mitch. With regards to the composition of the APRN Advisory Committee, thank you for pointing that out, because with the 2 bills that are being discussed at today's meeting that do deal with APRN practice nurse practitioners and certified nurse midwives, the board does need to make a decision about the composition of the APRN committee. This bill does specify that there's a new advisory committee specifically for nurse practitioners. So then the decision would need to be made whether or not you would continue the APRN advisory committee and or make the NP advisory committee a part of or a subcommittee of that APRN committee. So that definitely is a board action item, would be just how you want to deal with the current APRN advisory committee and the formation of this new NP advisory committee.
This is legal counsel Reza Pejhash. So that is a good point. The question of whether the current committee is just going to be expanded to meet the definition of the statute, or things like that, are issues that need to be considered and addressed by the board. This may be a question for maybe the board's executive officer, Loretta, or Michael, board president. Would this discussion, because we have an agenda item, it I think is 13, I want to say, about implementation of AB 890, and that may also include discussion about the current committee, or do we want to have that? We want to have that discussion now with this agenda item, or later at 13?
Reza, this is Loretta Melby, the executive officer. Item 13 talks about the implementation plan that's specific to 890. And that talks about establishing a nurse practitioner committee. That is separate from an APRN committee. The APRN committee that we currently have is not supported in statute. So once we start the new committees, the new CNM committee, as well as the new NP committee, we are going to evaluate resources at the board to discuss and find out what we can do about establishing a CNS committee and a CRNA committee. As was said in this presentation, the agenda item prior is that there are 4 advanced practice groups. We plan to have representation for all 4 advanced practice groups. We just have to look at the process with board staff and available funds, et cetera, so that we can make sure that that can go forward. That is not part of this specific agenda item, nor agenda item 13 or 14 later on to discuss the APRN makeup. That will have to come at a future date.
Okay, so then does it make sense? I brought it up because if we're discussing at 13, implementation of 890, which includes the formation of the NP committee, that conversation could also tie into the discussion about impacts on the current APRN committee. But so you think it would make sense to go ahead with that discussion now about impacts on the current committee?
Specific to APRN current committee, that would be covered in this agenda item. Agenda item 13 is just NP committee.
Got it. Thank you.
Joy Diefenbaugh would like to make a comment, but I don't see how she's connected. Let me see if I can unmute her. Hold on. Joy, are you there?
I'm on my phone.
Oh, there you go. We hear you. Go ahead.
Thank you. Appreciate the opportunity to comment. I'm a volunteer for AARP California. My name is Joy Diefenbaugh, and AARP strongly supported this bill by Assemblymember Wood. And we believe that California needs AB 890 now more than ever when we are experiencing a healthcare workforce shortage during this pandemic. We believe that AB 890 provides a measured response to the need for more accessible primary care in California and builds on a solid body of research that provides NPs high quality and safe patient care consistent with their education and professional training. AARP will be following the deliberations about the implementation of this legislation closely including, we hope, any new committee that may be created. And we look forward to providing comment on any proposed rules as they come out at a future date. Thank you so much.
Bryce Doherty would like to make a comment. 1 second.
On the phone, but watching.
Bryce,
I'm on the
Bryce,
phone.
go ahead.
Yeah. Can everybody hear me okay?
Yes.
I'm on the phone. Great. I'm watching the WebEx, but on the phone. So I'm Bryce Doherty. I'm here on behalf of the California Academy of Family Physicians. We represent 11,000 physicians statewide in all modes of practice, as you can imagine. We are eager to participate in this process with the BRN and all stakeholders. And as everybody is aware, the California Future Health Workforce Commission looked at these sorts of issues, and it will be impossible for us to implement AB 890 without taking a particular deep dive into the effect this is going to have on primary care. So we want to remain partners in this process going forward. I think the board has identified some major issues of focus, not only the transition to practice, but the makeup of the advisory committees and what have you. So we remain committed to that process as well and appreciate the work the board is going to undertake in this regard. We know it's not something that is going to be done January 1st of 2021, so we're committed to the process, and also would ask that the BRN, whether informally or formally, solicit the input from the Medical Board of California. There are certain things, obviously, that constitutes the practice of nursing when done by nurses regulated by the Board of Registered Nursing, and there's obviously things that constitute the practice of medicine, which are similar functions performed by physicians regulated by the Medical Board of California. So thank you for the time, and family physicians look forward to working with you and all stakeholders as we further implement AB 890. Thank you.
Yvonne Chung would like to make a comment. 1 second. Sorry, Yvonne, go ahead.
Oh, no problem. Good morning. Yvonne Chung with the California Medical Association. CMA will be following the implementation of AB 890, and we believe that the new law will have a significant impact on medical practice and the physician-patient relationship. We have more extensive comments about broad general implementation, but I think I'll save those for the later agenda item. Regarding this particular agenda item, the bill does direct the board to establish a nurse practitioner advisory committee to advise and make recommendations to the board on matters related to nurse practitioners. We believe that the membership of this new advisory committee should be recruited consistent with the new requirements of AB 890 rather than renaming the existing APRN advisory committee or rolling the new responsibilities into the existing committee. Selection of members for this new nurse practitioner advisory committee should be conducted in a transparent manner, and we recommend that this be done through the board itself rather than being overseen by the existing APRN advisory committee, as there might be potential conflicts if there were members who wish to serve on the new advisory committee. We also encourage the BRN to actively and broadly recruit physicians to participate in this new advisory committee and work with the physician licensing boards to do so. Thank you for your time, and we look forward to working with you.
Tim Madden would like to make a comment.
Great, thank
Go
you.
ahead, Tim.
Thank you. Can you hear me okay?
Yes.
Okay, super. Thank you for allowing me to make a comment. My name is Tim Madden, and I'm a representative of the California Society of Plastic Surgeons. So we're a group of board certified plastic surgeons in California. We just wanted to quickly point out that when listening to the discussion and debate over AB 890, it was very clear that the intent of the legislation was to address, as others had previously commented, on the workforce shortage in primary care. The bill is not limited to primary care. The scope that's established could be used in other areas of medicine. The concerns for the California Society of Plastic Surgeons is that there might be NPs who would be more interested in opening up med spas, providing elective cosmetic procedures. So we would ask the board, when going through the regulatory process, to clarify where specifically this scope would be allowed. There are other states that could be used as examples that do specify areas such as family practice or pediatrics, gerontology are common ones that we see in other states. But we think this would help clarify the intent of the bill and also really address where I think we can all agree is the need is for in primary care. So we look forward to engaging in the regulatory process and appreciate your time. Thank you.
Alyssa Brown would like to make a comment. Alyssa, go ahead.
Thank you very much. Alyssa Brown, I'm a clinical nurse specialist, and I'm on the Advanced Practice Advisory Board. I strongly support keeping that board with representatives from all 4 APRN groups. The intent was for us to work together to look at issues that affect all of us, and I think that should remain. The way that I saw the NP Advisory Committee being established, I saw it as the same model that the certified nurse midwives have currently. And that doesn't take away from the APRN Advisory Committee, nor do we take anything away from them, and some people may be on both. But there is also no talk that I know of from clinical nurse specialists, and I am on the board of CACNS, about wanting their own separate advisory committee at this point. Thank you.
Nancy Trego would like to make a comment.
Nancy girl.
Go ahead, Nancy.
Oh, this is Nancy Trigo. I'm a DNP and a GNP. Once am appointed to the BRN Advanced Practice Advisory Committee, how long is the term of service? And will that be the same for the new NP Advisory Committee? Thank you.
This is the board's legal counsel, Reza Pejhash. Somebody correct me if I'm wrong, but I believe the current term for the current APRN Advisory Committee is 2 years for members, but terms haven't been established for members of the Nurse Practitioner Advisory Committee that was mandated under AB 890.
Kathleen Belzer would like to make a comment. 1 second. Go ahead, Kathleen.
Thank you. I will be very brief. I am, again, the past president of the California Nurse Midwives Association. I just want to call in my support of AB 890 and the nurse practitioners in the state. And given the crisis we have in healthcare right now, and the fact that we spend more than any other nation on healthcare, I think anything we can do to remove barriers to practice to high quality practitioners is what we need to do. And I feel very strongly that the advisory committee should guide their practice issues and the implementation of their bill. Thank you very much.
Charlotte Gullop Moore would like to make a comment. Go ahead, Charlotte.
Thank you.
Good afternoon again, everyone. This is Charlotte Gullett-Moore, and I don't think I've mentioned before, but I am a DNP adult nurse practitioner practicing in the Santa Barbara area. I agree with a lot of the concerns and added information from everyone who's making a comment about this upcoming Nurse Practitioner Advisory Board. And yes, I believe the president of CANP, Patty Gurney, mentioned something about diversity. As I know, diversity can mean many things, so I really hope that in the construct of this committee, can someone mute? There's a lot of background noise. Thank you. In the development of this advisory committee, that we are cognizant of making sure that we have equal representation of gender and race as we move forward to develop this advisory committee. Thank you.
Chairperson Woods, there are no more requests for public comment. Would you like me to close this window?
Yes, I would. Thank you. This is Betty again. So the question is on this, where do we go from now? What do we do? We have a lot of information that we've been given, a lot of concerns over this bill, 890, and the things that have to be implemented more quicker than other things. So I'm not sure what we ought to do with this right now. We have the question of should the...
Well, Betty, there is no action for us to take right now because we have to formulate the NP advisory committee first. Then we make a decision on the APRN advisory committee, as Lori said.
Well, we're not going to be doing that today.
Exactly. So there's no action for us to take.
So we...
This was information.
Of course, we've got a lot of information. And
this is Reza, legal counsel. On the issue of the impacts on the current APRN advisory committee, I mean, that is an issue that can be discussed today. If no action is taken, that to me just means that the current APRN advisory committee continues under its existing mandate, unless and until something changes later on with the implementation.
well, when can we discuss this further? I mean, there's a lot of things in here. I don't think we're going to be solving them all today, obviously. Even just this question of this committee. Where do we take that to?
Betty, there's another board meeting that specifically deals with the advisory committee next month.
Didn't know that.
Michael, I'm sorry, I didn't hear you. Michael?
Yeah, Betty, there's another board meeting where we're going to be dealing with the NP committee next month.
All right. So we can put this on the agenda for the January committee meeting? Hello?
Lori, are you able to explain, Betty, what's happening next month?
Hello?
Please?
Betty, are you able to hear me? This is Loretta, the executive officer. Betty, are you able to hear me?
I hear you, yes.
Thank you. Currently, what we're doing is we have a special board meeting that is being held December 17th or 18th. We do not have the specific date yet. There was an email that went out to board members for their availability.
Right.
That will be the committee, that will be the board meeting where interviews will take place to fill the positions for the NP committee and the CNM committee. The board members will do those interviews and will make the appointment of the committee members that will move forward with the new committee structure. That new committee will then be established, and they will start the process of working with our board members to implement 890 and 1237. Currently, we have two other advisory committees, the NEWAC committee and an APRN committee. Those committees are not in statute, but we are looking at our financial situation, at our staff availability, about the impact that it would have to those people, to the practice, to education, to the advanced practice RNs, both the CNSs and the CRNAs, as well as NPs and CNMs, to see what we can do to move forward to ensure that everybody has a voice. If or when changes are made, we will put that on a practice committee agenda, and that practice committee agenda will then move forward to full board for voting.
Okay.
We do not need to add this to the next coming meeting, because we are not sure that movement will be completed by that point. As soon as we have a definitive plan, we will add to the next practice committee.
Okay, so it'll be moved until next month, so we can discuss more. And can we move on now to 9.5? Since we're not making any motion right now on this. Hello? Hello?
Yes, please. Let's go.
This is
Yes,
Jeanette
please.
Wackler.
All right.
Okay, this is Jeanette Wackler.
Yes.
And we have another presenter for the nurse midwifery bill, which is SB 1237, and it's Paris. And I think Paris, you're probably on the line.
Hi, I'm here. Thank you.
Thank you.
All right. Are you guys ready for me?
Yes.
Yes, we are. Thank you.
Okay. Thanks for giving me time to speak today. My name is Paris Mullisbury, and I am a nurse midwife in California and the president of the California Nurse Midwives Association. As you know, our association represents and advocates for the nurse midwives in California, for the advancement of nurse midwifery and the midwifery profession as a whole, and for improved access and outcomes for all patients and birthing people. You are obviously well aware of Senate Bill 1237, the bill that finally removed physician supervision of nurse midwives. The Nurse Midwives Association was heavily involved in the creation of SB 1237, and therefore we deeply understand the language and its intent. SB 1237 was carefully crafted to reflect how CNMs currently practice within a collaborative, team-based model in all settings, but simply without the onerous requirement of physician supervision. And by design, the bill is succinct and straightforward, and because it was crafted to reflect current practice models, we are confident that implementation will be equally straightforward. I want to take like 2 minutes today to just touch on a few important components of the bill. The first is Section 3, and Section 3 references Business and Professions Code 746.2, establishing the mandate for the Nurse Midwifery Advisory Committee. Now, as a statutorily mandated committee, the Nurse Midwifery Advisory Committee must advise the board on all things related to nurse midwifery, including all matters related to midwifery practice, education, appropriate standards of care, and other matters as specified by the board, and provide recommendations or guidance on care when the board is considering disciplinary action against a certified nurse midwife. This section also increases the number of committee members to 7 to include 4 certified nurse midwives, 2 qualified physicians, and 1 public member. The importance of this section cannot be overstated. It was the bill author's intention that anything related to nurse midwifery should be referred to this committee for advisement. so that the Nurse Midwifery Advisory Committee could have a more robust involvement in any rulemaking that may occur because of SB 1237, and to have more involvement in nurse midwifery practice in California. To that end, it is the hope of the California Nurse Midwives Association that the intention of this bill will be fully implemented, and that Nurse Midwifery Advisory Committee will also be provided with the ability to do its job effectively. CNMA was happy to hear, and we agree with the decisions noted at the recent Midwifery Advisory Committee on November 10th that would increase the number of NMAC meetings per year to quarterly meetings in order to effectively advise the board. We are also aware that the application process for the new committee will begin soon. I'm looking forward to seeing those emails coming through our inboxes. We ask that the board utilize the CNMA to assist in any way that we can, where appropriate, in identifying qualified candidates for this committee who are ready, willing, and have the background to advise on nurse midwifery in this state. Secondly, moving on to Section 5 of SB 1237. This section allows nurse midwives to directly procure supplies, devices, and non-narcotic medication. And this is essential to nurse midwifery practice, especially in the out-of-hospital setting. We understand from our licensed midwife colleagues that after supervision was removed for them in 2013, that they had significant problems in directly procuring the supplies and medications they needed without a physician signature. And to that end, we are pleased and agree with the motion made by the Nurse Midwifery Advisory Committee in last week's meeting to recommend that the board post an advisory on the BRN website stating to suppliers that all CNMs may directly procure supplies and devices and non-narcotic medications in alignment with the scope of services described in the bill. Any delay in suppliers directly providing these lawful medications and supplies could be detrimental to continued nurse midwifery practice, and more importantly, detrimental to patient safety, especially in the out-of-hospital setting. Finally, Section 5 of the bill authorizes nurse midwives to perform episiotomies and to repair first and second degree lacerations of the perineum in any setting, including the home, and without standardized procedures. Given the current pandemic, this is extremely important. No birthing person should unnecessarily be transferred to a hospital setting where they might inadvertently be exposed to COVID-19 to lend further overburdening of our healthcare system, when the reason for that transfer is simply to repair a laceration or episiotomy that can lawfully be done in the home setting. To that end, CNMA is pleased by and agrees with the motion made by the Nurse Midwifery Advisory Committee last week that recommends to the board to post an advisory on the BRN website stating that all CNMs may perform episiotomies and first or second degree laceration repair in any setting and without standardized procedures. Our ask for the board today is that you make a motion to approve the recommendations made last week by the Nurse Midwifery Advisory Committee. The California Nurse Midwives Association is ready to assist the board in any way we can with the implementation of SB 1237. We hope that you continue to utilize our vast knowledge of our own profession to consult where appropriate moving forward in this process. Thanks.
This is Betty. Thank you very much for that report. And it's certainly, the nurse midwives bill is a lot more clear than the nurse practitioner bill. And I think what you're asking us is that we post this on the website. Is that your final thing that you're asking us to do, or
Yeah.
what you're asking us to do?
Yes, our request is that you enact or move to support the motions that were passed in the NMAC committee, specifically at this moment, that those notifications be posted on the board website so that there is clarity in expediting nurse midwives being able to independently procure and prescribe without hangups, because it's been a barrier in the past, according to our licensed midwife colleagues, and we don't want to put any we don't want to compromise safety for patients if they need, if they need Pitocin or something after giving birth. We want to make sure that we keep everybody safe.
Yeah, I was on that.
Betty, this
yes.
is for informational only. There's no action required for us because you can direct staff to update the website as needed. And any recommendations that the committee, the midwife committee passed, they have to go to the nursing practice committee in January.
All right. I was on that nurse midwife advisory committee meeting actually on the 10th of November. And it was all pretty straightforward. And I don't have any questions about it personally. But I'd like to see if any of the board members do.
I don't have any questions. Like I said, you can direct staff to update the committee, update the website.
So we don't have to take a vote on that.
No, we don't need to take a vote on that.
I was at that meeting, and I was
Betty,
pleased with the presentation.
we don't need to take a vote on that to have information updated on the website. And information that they have and they voted and passed on, it can be put off until it has to go through the nursing practice committee in January. Then it gets brought before the board.
Would it be okay if I just interjected here for a moment? Again, this is Paris.
Yes, please.
I appreciate it. Thank you. I just want to express our concern in the delay of this being implemented. The bill changes the law effective January 1st, and waiting for this to go before the practice committee and then to go before the next board of directors committee meeting delays that communication.
Paris, this is the way the board functions. Your committee brings information forward, and it gets taken to the nurse practice committee, and then it goes before the full board. That's not a delay. That's the way it functions, the board function.
Also, this is legal counsel. If I could just make a quick comment. Thank you. This is Reza Pejihach. I believe we're on agenda item 9.5, which talks about the impact of SB 1237 on the Nurse Midwifery Advisory Committee. And I'm not sure that the recommendations of that committee at their last, at their recent meeting necessarily fits within this agenda item. So I would suggest, as Michael suggested, have it go, the normal route that it would through the practice committee and then to the board, and handle it that way.
Can I just say one more thing?
Yes.
Thank you. So at the last practice committee meeting, we were there in attendance and prepared to ask that this be addressed, and we were skipped over. They tabled discussion on SB 1237 without actually addressing our agenda item. At that time, we were lumped in with AB 890. And so we were prepared to discuss that during the practice committee meeting. And the discussion then was that everything within that would be addressed at the board of directors meeting. And we were pacified and assured that this would be discussed and decided on now.
So this is Loretta, Executive Officer. To be clear, at the practice committee, where 890 and 1237 were voted to go together to discussion at the full board, where that took place, what could have occurred there would have been public comment. When public comment is heard, it could be heard and not acted on, or heard and added to a future agenda. So the possibility for the practice committee to have heard that and move that, it would have been added to a future practice committee agenda. Therefore, it is not negatively affecting any of the process. by when our board president, Michael Jackson, moved 890 and 1237 together to go to full board. Additionally, it is in statute. The advisory statements that you are asking to be placed on our website is in statute. It is specific from that statute, and that is on our website. Additionally, we have talked about doing an FAQ for further clarification, and that is something that we can move forward as the EO and board staff and get that completed without having to do an advisory statement. So we will have something on our board website that will allow for support and call outs of these changes for January.
I very much appreciate that. Anything we can do to clearly communicate with consumers, with DME providers, with everybody, all of our stakeholders would be really helpful. The sooner the better, so that we can quickly provide safe care to those who need it. You probably know we have 9 counties in this state that have no maternity care provider. And we're anxious to be able to get midwives into those counties and start helping to provide care for those women.
Yes, I'm absolutely aware of that. I was a labor and delivery nurse for many years, and I'm totally in support of midwifery practice. What needs to be followed here, though, is our rules and regulations and statute, and that's what we will do here at the BRN. Additionally, the same comments that I made to you yesterday in the APRN meeting was that when you're dealing with your DMEs, please take it upon yourself to direct them back to statute. They cannot argue with statute, and just be proactive in that manner. We will do our due diligence as well to have these highlights on our website so that they're easily accessible.
Will do, absolutely. I appreciate your guidance and support in that arena. Thank you.
So that will be put on the board website soon.
Yes, Betty, we will do a FAQ for both NPs and CNMs. We will not do an advisory statement. That is something that would be moved to the practice committee agenda to January, and then can be voted on by the board in February. But what we will do is do an FAQs for our website.
Thank you.
You're welcome.
Any other comments from the board? Can we move to any comments from the public?
We'll be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for the members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Yvonne Chung would like to make a comment. 1 second. Go ahead, Yvonne.
Yvonne Chung, California Medical Association. SB 1237 more clearly defines the scope of practice for certified nurse midwives and mechanisms for physician interaction in the absence of standardized procedures. It is our understanding that the BRN will be conducting outreach to the medical board and the osteopathic medical board to solicit assistance with identifying physicians to serve on the Nurse Midwifery Advisory Committee that's being established. We believe that the membership of this new advisory committee should be recruited consistent with the new requirements, again, rather than rolling the new responsibilities into the existing CNM committee. And similar to our earlier comment, we encourage that selection of members for this new advisory committee should be conducted in a transparent manner and done through the board itself. We are very supportive of all of the board's activities to actively and broadly recruit physicians to participate in this new advisory committee. Thank you.
Ryan would like to make a comment. 1 second. Go ahead, Ryan.
Thank you. Ryan Spencer on behalf of the American College of OBGYNs District 9. I would like to echo the comments made by Ms. Chung from the California Medical Association, and also say while ACOG was neutral on the bill, it was also very involved in the development of the language, including the new advisory committee, which is noted was created to include 2 qualified physicians as members. We also support the comment made earlier that all issues related to midwifery, particularly discipline, should be directed to the advisory committee. As you solicit members of the committee, we just encourage the board, in addition to the Medical Board of California Osteopathic Board, to utilize the assistance of ACOG to ensure the slots to qualified physician members are indeed filled and filled by qualified physicians who are, in our opinion, should be obstetricians and gynecologists. Thank you for your time.
Holly Smith would like to make a comment. Sorry, there she is. Holly, go ahead.
Thank you. Yeah, Holly Smith, Health Policy Chair of CNMA. Just wanted to say thank you for not skipping over us this time in this meeting. We appreciate that. It's nice to have a voice. Secondly, I would just like to say that appreciative of putting an FAQ on the website to draw attention to the ability to directly procure supplies and devices, because we note that our licensed midwife colleagues had this same exact situation where their statute was posted, but just having the statute posted was not enough. And although we like to say it's really clear, just direct folks to statute, that clearly wasn't enough and led to delays in their ability to be able to procure those supplies, devices, and medications. So I'm happy to hear that this will be an actual FAQ, and I hope it's easy to find, and I hope it is available by January 1st. Thank you.
Kathleen Belzer would like to make a comment. Go ahead, Kathleen.
Hello, thank you very much. I want to say that working with CNMA to create the language of this bill, we are extremely proud of the work that we did on SB 1237. Our team worked tirelessly to come to consensus with CMA and ACOG and develop the best legislation possible. We also created and put into statute an integrated team-based model of care. These integrated team-based models of care are have been shown in numerous studies and reports to improve safety and build consumer protections. So as we go forward and with the applications for the NMAC committee, I request that in statute it says qualified physicians are recruited. I would request that we recruit physicians who are already well versed in integrated and team-based models of care. That is my comment. Thank you very much.
Chairperson Woods, there are no more requests for public comment. Would you like me to close the window?
Yes, please.
Would it be okay if I said one more thing?
Absolutely.
Thank you.
Yes.
Thanks again. I just wanted to take a moment to thank our colleagues at CMA and at ACOG for the hard collaborative work that went into putting this language together and to getting the bill passed. I think that the intent of this is to increase access to high quality care for people in this state, and it is not our intention to be cowgirls in this. It's our intention to work together to make sure everybody gets what they need. And I think that was demonstrated beautifully in the process of working out the language for this bill and working together to get it passed. The idea that we are all colleagues forming a circle of care around birthing people who deserve and need access to care. So I just wanted to extend my gratitude and appreciation there.
This is Betty again. Thank you, everybody, for your input into all that. It's a lot of information. And so we're going to have the information on the board that we can put there. And then in our next meeting, we can discuss other things that need to be addressed. Anybody else have anything to say, since we're not voting on anything right now? There's nothing going forward for a vote. Not hearing anything. I will